Welcome dear viewers, professionals and learners to the video on drug pKa and absorption through the GI tract, that is gastrointestinal tract. So in this video mainly we are going to see what are the factors affecting the drug absorption through the GIT. Mainly the video will deal with the pH pK, ionization of the drug and how the drug get absorbed. First of all we will see the basics like what is pH, what is pKa, and how these things are related to the drug absorption. pH is the value or it is a measure of the acidity or alkalinity of the solution, and the pH scale is very well known to the people and the professionals, that is the scale of 0 to 14. So if the pH is on lower side, that is acidic side, and if it is towards higher side, then it becomes basic. In simple meaning, the pH is the measurement of hydrogen concentration. Then what is pKa? pKa is the value or pKa is the measure which describes the acidity or basicity of the particular molecule. The molecule may be drug molecule, and if the pKa is on lower side, it suggests that the drug is having a acidic character. Lower pKa means the molecule is stronger acid. Higher pKa means the molecule is stronger base. The pKa value is the negative base to the 10 logarithm of the acid dissociation constant, that is Ka of the solution. And the chemistry student will understand these terminologies very well. Here I have included these things only for your better understanding and knowledge purpose. The acid dissociation constant, that is Ka of the solution, is pKa. And pKa determines the ionization of the drug molecules. Ionization is affected by the pH of the environment, and ionization affects the GI absorption, and that's why it affects the bioavailability. So now you think that how the pKa of the drug molecule is related to the GI absorption and the bioavailability. So whenever you are developing a formulation, that time don't forget to check the pKa of the drug molecule. Now we will see what is drug ionization, what is unionized form, and what is ionized form of the drug, how it is related to the pH and pKa. Unionized form, it is also called as unchanged form of the drug, and unionized form is lipid soluble. Unionized form has lipophilic character, and as it is lipophilic, it crosses the cell membrane easily. See, the cell membranes are lipid in nature, that's why the lipophilic molecules cross the cell membrane easily. This is very basic thing. To understand that unionized or uncharged form of the drug is lipid soluble or it is lipophilic, and that's why it is well absorbed. Then coming to the ionized form. Ionized form of the drug is water soluble, that is hydrophilic. It is exactly opposite to the unionized form. The hydrophilic form is not able to cross the cell membrane easily because the cell membranes are lipidic in nature. Ionized, or it is also called as charged form, and that's why if the drug molecule becomes charged or if it becomes ionized, then it will be less absorbed. Now understand pH lower than the pKa. If you put your drug with certain pKa in certain pH environment, then depending on the drug pKa, the pH will have impact. pH, if it is lower than the pKa of the molecule, then the molecule remains in the unionized form. The unionized form of the drug is well absorbed. Then if the pH is higher than the drug pKa, that time the higher pH will lead to molecule to get ionized, and that's why the ionized form will be formed, which is less absorbed. Now let's see the GI pH. The drug absorption is affected by its pK and the pH of the GI tract. See, the GI tract has varying pH in the different regions. So depending on the pH environment of the GIT, the absorption of the drug molecules will be affected. GI has a pH different in different regions. Stomach has acidic pH and the intestine has alkaline pH. Many of the professionals are very well known to this phenomena, that the stomach is having acidic pH and the pH environment of the intestine is alkaline. Stomach pH is around 1.5 to 3.5 and sometimes 5. Sometimes it varies between 4 to 5. And the volume of the stomach fluid is around 20 ml to 100 ml. Also, the fasting and fed state has impact onto the stomach volume, stomach fluid volume and the pH. Small intestine is having a pH of around 6 to 7.5, and as per the different regions the pH is different. Duodenum pH is 5.5 to 6 around, jejunum pH is 6 to 7, and colon is having a pH of 7. pH of GIT also differs in the fasted and fed state. Now consider the drug pKa and the pH of the GI tract. So if you have a drug molecule with pKa at acidic site or pKa towards basic site, or if the drug molecule is not having the pKa, or the drug molecule is having a pKa which is not inside the physiological pH range. For example, the physiological pH range is considered between 1 to 6.8, or sometimes it is 1 to 7.5 pH. So consider the example of acidic drug with lower pKa value. If the drug is acidic and if its pKa is on lower side, it will remain uncharged in acidic pH environment, and thus it will get absorbed from the acidic pH site. For example, we will consider here the aspirin. Aspirin is also called as or also known as acetyl salicylic acid. The pKa of aspirin is around 3.5 and it is acidic in nature. Then the pH of the stomach is also acidic. So as we have seen in the previous slides, the acidic pH of stomach will not ionize the aspirin. In acidic pH of stomach, aspirin is unionized, and that's why it will get absorbed from the stomach. Then consider the example of drug which is having pKa towards basic side, or the drugs which are basic in nature. Basic drugs with higher pKa value will remain uncharged in the basic pH and thus can get absorbed from the intestine. The pKa of metoprolol is 9.7 and thus it is basic in nature. The basic pH of intestine, metoprolol, is unionized and it will get absorbed from the intestine. Now consider the example of drugs which do not have pKa in the physiological pH range. So will these drugs can will these drugs will can get absorbed or will have a dissociation or will not have dissociation or ionization. So certainly the drugs the, the drugs which have pKa outside the physiological pH range will also get absorbed. The example is empagliflozin. It is having a pKa of 12.57. It gets absorbed rapidly from the intestine with the Tmax of around 1.5 hours. Another example is canagliflozin. Canagliflozin does not have pKa in the physiological pH range, but it gets absorbed rapidly from the intestine. So whenever you come across such an example with drug which is not having pKa in the physiological pH range, so do not think that it will not get absorbed. The drugs which don't have pKa in the physiological pH range will also get dissociated somewhere in the GIT. Sometimes their solubility, their lipophilicity will have a great impact onto the absorption, and that's why these drugs will get absorbed. So it is not a thumb rule that the drug should have pKa in the physiological pH range to get absorbed. Many other factors are also there which affect the drug absorption through the GIT. The factors are particle size, surface area, solubility, permeability, lipophilicity. Then the important thing is viscous class of the drug molecule, then absorption sites and the physicochemical properties of the drug substance, dissolution rate of the formulation if it is oral solid or oral liquid formulation, polymorphism of the drug substance, log P value, pKa value and many others. Sometimes the drugs are required to be protected from the acidic environment of stomach, and that's why based on the requirement the formulations are designed. So this is the generalized information about the drug pK and absorption through the GIT. I hope I have compiled the required data to understand the impact of drug pK onto the drug absorption. Thank you for being with the video. Thank you for watching the videos on Pharma Learning in-depth channel, and I hope you are getting benefited from the videos. I request you to like, share and subscribe to this channel and share to your friends so that they can also learn the things which are required as a professional. Thank you.